Lupus can be a dangerous disease if it's missed, and lupus can attack any organ of the body. It is one of the biggest mimickers of different diseases and can be missed by many doctors. A lot of doctors are simply not trained to recognize and diagnose lupus and its symptoms. If you don't educate yourself on lupus, you can miss the early warning signs of lupus. I'm Dr. Micah Yu. I'm an integrative rheumatologist, and today we're going to be talking about the early warning signs of lupus that you shouldn't miss. Lupus can attack you from head to toe. I have seen patients going from doctor to doctor with lupus, but their doctor never recognizes that it's lupus, or they're sent to the wrong specialist, and they're sometimes told that all the symptoms are all in their head, which is totally not true. I've seen patients early on in my clinic with very early signs of lupus, but I've also seen patients with lupus at the end stage of their disease or in a very advanced state of their disease, never diagnosed, and the first time they're diagnosed is in the hospital or worse, in the ICU. I've seen patients that were told that they have lupus, and the first time they ever heard of it was when we had to tell them their end-stage kidney disease was from lupus, and they didn't know that they had kidney issues to begin with. Or they came in the hospital with a coma, and lupus actually attacked their brain to the point where they were in a coma, and they were revived from the coma after they were treated for lupus. So these conditions can be treated, but hopefully they're not recognized too late. So you want to catch lupus early so that there is no end organ damage, such as damage to the kidneys or the lungs or other parts of your body. With that said, let's go over the 5 early warning signs of lupus. Early sign number 1 of lupus is joint pain and stiffness. If you're getting joint pain and stiffness, especially with swelling as well, you want to think about lupus. Because yes, you can see joint pain and stiffness in menopause. You can also see it in rheumatoid arthritis. You can also see it in osteoarthritis as well, which is wear and tear. But if you're getting morning stiffness for at least 30 minutes or longer, you're getting swelling of your joints, and your joint pain gets better with movement, you want to have lupus in the back of your mind. Even though chances are it may not be lupus, you want to think maybe it could be lupus, and you don't want to miss it. And the way to diagnose lupus with joint pain and stiffness is by looking at the labs. Early warning sign number 2 is sun sensitivity and skin rashes. Now let's break this up into 2 components here. Let's talk about the sun sensitivity. So patients with lupus can be very sensitive to the sun, so they can get red within maybe 5 minutes, 10 minutes, or even a couple minutes in the sun. So it's called photosensitivity. Now let's talk about skin rashes. Skin rashes in lupus comes in different forms. It can come with a mallow rash or butterfly rash where the face gets pretty red with or without sun exposure. Other parts of the body, you can get red blotches on your legs, on your arms, on your back. Different parts of the body can have itchiness and redness on there. And you can get discoid lupus where you can get some scarring from these rashes. The celebrity seal has something called discoid lupus where he has scarring of his face. That's discoid lupus. So you want to make sure you see a dermatologist if you have a rash going on that doesn't go away, because it could be coming from lupus. And you want to take care of this early on, because that might be the first sign of your lupus, and there could be other signs coming along the way if you don't treat the skin lupus. Sign number 3 is recurrent fevers without any other cause. So if you're getting recurrent fevers and your doctor has ruled out infections, they have ruled out cancer, then you want to think about autoimmune diseases. And one of the autoimmune diseases that can cause fevers is lupus. When you're in the hospital or in the outpatient setting and you are having fevers and no one can figure it out, that's called a fever of unknown origin, also known as FUO in medicine. If you're having fever of unknown origin, then 3 things that we always think about in medicine: infection, autoimmune diseases, and cancer. And in my field, I focus on autoimmune diseases. Now, lupus, if it's causing it, you want to confirm it with the labs. So you're gonna get the ANA, anti-nuclear antibody, double-strand DNA, the complements, which are C3, C4, and the other antibodies reflecting off the ANA. And that can help determine whether it's lupus causing the fevers. And I've hardly seen fevers just from lupus alone, but it can happen. Usually when you have fevers, you have other symptoms of lupus also already. Early warning sign number 4 is hair loss, also known as alopecia. So you can get hair loss in lupus, and it can come diffuse where different parts of your hair are coming out all over, or you can have just chunks coming out, and they can be scarring where when you take that chunk of hair out, hair doesn't grow back in that region. So there are different forms of hair loss in lupus. So if you're having hair loss over and over again and your regular doctor or primary care doctor can't figure it out, then you want to talk to your dermatologist and eventually a rheumatologist, because it can be lupus driving the hair loss. And the only way to confirm that is through labs again, and possibly a biopsy from a dermatologist. Another early warning sign that's pretty common amongst many other conditions is fatigue. Because there's a lot of inflammation in lupus, you can get fatigue very early on. Now, when patients just have fatigue alone, doctors and patients aren't thinking about lupus. But it could be a very early warning sign because of the systemic inflammation that's happening in the body. And when that's happening, you want to get labs for lupus, of course, which I mentioned earlier, but you want to talk to your primary care doctor, making sure there's no hormonal issues, there's no infections going on, there's no cancer driving the fatigue, and you want to rule out the other autoimmune diseases as well. And also you want to make sure that your work-life balance is balanced out, because if you're working too much, you're stressed out too much, that can also cause fatigue as well. So we talked about some of the early warning signs of lupus, but I want to point out some other signs of lupus that you should not miss. And it can be missed by your regular doctor, especially if you're just getting routine labs. The first one is lupus of the kidneys. One of the ways to detect this is looking at the protein amount in your urine. It's called the urine protein, but more importantly, you want to get the urine protein creatinine ratio. And when you're seeing urine protein creatinine ratio going higher and higher, and especially when it's above 500, I get really concerned about lupus from my field in rheumatology. Sometimes your doctor will get a urine protein and they'll see some of it and they might miss it or ignore it. Don't ever ignore protein in your urine, because that's not normal. That means your kidneys is leaking out protein, and that's not supposed to happen. And that can come from inflammation. That can come from lupus. That can come from another disease with the kidneys that's not related to lupus either. So you do not want to ignore that. Also, if you're having trouble breathing, you also don't want to ignore lupus also. It can come from lupus, but it can come from many other diseases as well. Sometimes it's also known as interstitial lung disease if you're having trouble breathing even at rest. Of course, it can come from heart failure causing difficulty breathing and many other issues, but sometimes it can come from interstitial lung disease, which is simply inflammation and scarring of the lungs. And this can come from lupus. So that's another sign of lupus that you shouldn't miss. So I hope you learned something from this video, and tell me, what early warning sign of lupus have you seen with your symptoms? And if you learned something from this video, please hit the like button and subscribe to this channel for more information just like this, and comment below on what you want to see next in my future videos. And if you want to see me in my clinic, you can find me at drlifestyle.org. I'll see you guys next time.